pain is one of the most common foot problems affecting adults of all ages. The heel bone is the largest of the 26 bones in the foot. As the first part of the foot to make contact when walking, it is not surprising that the heel sustains undue stress. This stress can be the result of an injury, bruising from walking, running, or other activities, wearing improper footwear, and possibly from being overweight. Heel pain is typically the result of abnormalities in the biomechanics of the feet. The two structures associated with heel pain are the plantar fascia, a band of fibrous connective tissue, and the flexor digitorum brevis muscle, which supports the arch and flexes the 4 small toes. Generally, the foot functions by absorbing the weight of the body, and the arch of the foot flattens. The plantar fascia and the flexor digitorum brevis muscle stabilize the foot and sustain the arch. Inflammation and pain to the surrounding structures of the heel are a direct result of gait abnormalities. Heel pain is most prevalent in active people, those over the age of 40, those who are overweight, women, and those who wear poorly fitting footwear. The diagnosis for the cause of heel pain may involve a thorough history of symptoms, a physical examination, and imaging tests such as X-rays or ultrasound. Once a diagnosis is made regarding the cause of the heel pain, a treatment plan will be implemented. Heel pain is typically caused by stress to the structures that support the heel bone. The most common cause of heel pain is from plantar fasciitis. Plantar fasciitis is caused from inflammation to the plantar fascia, a band of fibrous connective tissue running along the bottom of the foot from the heel to the ball of the foot. When the plantar fascia is continually stretched past its normal extension, tears in the fiber occur. The result is pain, inflammation, and possibly bone spurs. Pain associated with plantar fasciitis may disappear as you perform normal activities, only to reappear with rest. The pain may also be profound with strenuous exercise compared to moderate exercise. Aggravation to the area may occur with improperly fitted footwear and from chronic irritation due to an overly athletic lifestyle. Not all heel pain is caused by plantar fasciitis. Achilles tendinitis can cause pain in the back of the heel. This condition occurs when the tendon that runs from behind the ankle and connects at the back of the heel is strained, causing tears along its length. The result is pain, inflammation, and possibly the development of a heel spur. A heel spur is a bony growth on the underside of the heel bone. Visible by X-ray, a heel spur is typically a byproduct of the strain placed on the muscles and ligaments of the foot. Bursitis, arthritis, stress fractures, a neuroma, a bone bruise, and Haglund's deformity can all cause pain in the heel as well. Excessive pronation of the foot can cause abnormal stretching and pulling of the ligaments and tendons attached to the heel bone, resulting in pain. Excessive pronation can also lead to problems with the knees, hips, and possibly the lower back if not cared for. Heel pain should be addressed by a podiatric doctor immediately. Pain is the body's way of alerting us to damage and to seek medical attention. A podiatrist is uniquely qualified to diagnose and treat pain associated with the heel. They can provide you with a variety of treatment options, as well as valuable information and education to prevent future pain to the heel and foot. After being diagnosed with a cause for your heel pain, your podiatrist will offer a comprehensive treatment plan based on your individual needs. A conservative approach will probably be implemented first. This may involve oral or injectable anti-inflammatory medications, applying ice for swelling and pain, taping the foot to support the arch, recommendations on proper footwear, stretching of the calf muscles to help with Achilles tendinitis, physical therapy, and possibly utilizing an orthotic device. The orthotic device may be beneficial in correcting biomechanical misalignments, offering support to the tendons and ligaments sustaining the heel bone, and controlling excessive pronation of the foot. The utilization of an orthotic device may effectively treat the problem without the need for surgical intervention. Shockwave therapy is another conservative approach that may be beneficial. This non-invasive surgical procedure uses sound waves to treat chronic heel pain. The process is done on an outpatient basis and typically takes about 30 minutes using local anesthesia. The shock waves are aimed at the localized site, producing increased blood flow, creating a healing response. Typically, patients are able to resume normal activity the day after treatment, although strenuous exercise and heavy lifting should be avoided for at least 4 to 6 weeks. Conventional surgery may be necessary to treat chronic heel pain that has not responded to conservative treatment. Surgery typically involves releasing the plantar fascia tissue or removing a bone spur or bursa. When the plantar fascia is released, the arch of the foot may not function normally and will require additional support. Orthotic devices will be prescribed and should be used to provide extra support and alignment for this imbalance. If the imbalances are not corrected, hammer toes and bunions may develop, causing pain and disfigurement. Your podiatrist will discuss all treatment options with you and come up with a comprehensive plan based on your individual needs. They will make sure you are educated and well informed about your condition and treatment. Preventing heel pain is easy when you follow a few simple guidelines. By utilizing certain steps, you can ensure optimal health for the heel and foot. These steps may include 1. Wearing shoes that fit correctly and replacing them when they become worn. 2. Wearing shoes that are appropriate for the activity you are performing. 3. Stretching properly before you do any type of exercise. 4. Not exercising through heel pain. Stop immediately if you notice any discomfort. 5. Maintaining an optimal weight through proper diet and exercise. 6. Avoid walking in bare feet, on uneven surfaces, and on rocks. Any pain you feel in the foot or heel that lasts longer than a month should be addressed by a podiatric doctor. They have been trained in the diagnosis and treatment of foot conditions and can help you retain the health and wellness of your feet. By following these simple guidelines, you can ease or even prevent heel pain.